Dr. Tural, let's talk about a child who's kind of getting under the weather, cold, and, a child who maybe goes to school already, or is kindergarten and stuff. When should a mom start worrying about leaving the child home? What should she do? Give us that like typical flu type of thing. And maybe mom is worried. Is that just a tiny little cold? Is a cold and a flu a different thing? Should she be worried about the swine flu, the bird flu, the whatever? Give us, describe those things for us and give us a little bit of a home remedy book, or at least like what should you do? School, no school, doctor, no doctor.
Okay. In the winter months, of course, if you don't live in California, you have to be confined to indoors mostly. And that's the perfect breeding ground for the germs. And then germs spread in schools and daycares and what have you. So sometimes daycare workers are careful excluding the sick ones from coming to daycare, or schools are very diligent in limiting the exposure or spread of the infections during the winter months. Common cold is something that you would have only upper respiratory symptoms of runny nose and maybe a little sore throat and a low-grade fever and with or without coughing. Oftentimes cough would be not a part of it, but sometimes it could be. But when the symptom list involves abdominal pain and a cough, high fever, vomiting, and sometimes diarrhea, that would make it in the category of flu. Flu is a more serious health hazard, health problem, and then some of them are, by definition, rapidly spreading and then causing great impact on the community, and then they become pandemics. Those are the bird flu that you mentioned, or swine flu. Those are the type of flus that are potentially very dangerous. And then that's why we try to, the medical community, we're trying to limit the spread of those diseases, infections, by getting good rates of immunizations, vaccines against the flu. And our efforts last year against...
Sorry to interrupt you here. You did in another video mention that, because there's lots of controversy out there, should we do vaccine or not? And you mentioned, yes, you should, because even the ones who kind of claim that I did fine without vaccine, you say that that's mainly because 98% of the rest of the people are vaccinated, so you're benefiting from it. So overall, you do believe that a child should get its vaccinations, and I'm sure a pediatrician like you will inform the child of exactly what vaccination at what age should be taken. And we may be talking about it a little more down the road, but is that what you're talking? So you are saying that straight off,
yes,
get your child vaccinated?
This is another example. Last year we did a vast vaccination campaign against the swine flu, and Europe did not take it as seriously as we did. And this year we are seeing fatalities, like some people are dying from swine flu in Europe, whereas in the United States I don't hear anybody getting the same outcome. So with that, the last year's immunization campaign is paying off this year. So we have better immunity against the swine flu, therefore there is no deaths in the United States attributable to swine flu epidemic.
Now what should a mom do, so the child is let's say, immunized, or is not, anyway, gets the flu, which is, as you described, it goes much further than just a little cold, which is usually limited to somewhere up here, not being able to breathe too well, and then usually goes away. But so what should a mom do there, whether the child was getting the vaccination or not? What's, bed rest, heat, dump them in the hot swimming pool? I mean, what should you do? Give him teeth, 3 gallons of it?
Right. What if you miss the first part of it, like by not vaccinating the child, you're now at the mercy of the flu germs virulence. Like sometimes the germ comes and affects the community and then causes some deaths. But short of that, what a mother should do is symptomatic care. Symptomatic care involves like a lot of fluids, as you were mentioning, a lot of fluids, and then controlling the
hot or cold fluids doesn't matter.
Doesn't matter as long as they drink and plenty of it. They would be doing the right thing, and then also pain and fever control.
One more question here, just to make sure, okay? I may be ridiculous here, but probably am. Lots of fluids, plenty, hot or cold. Does that include Coca-Cola and other sodas, or is that surely something you want to stay away from it when you talk fluids?
Well, the ideal fluid probably would be juice water, but if you are a person who never drank water and juice, there are such people, then any kind of fluid will do. Yeah, I much rather them have drink their Coca-Cola than not drink anything. Okay. But advisable fluid types would be water, number 1, and juice, number 2, preferably vitamin C containing juice, and other drinks would be the next level of acceptable fluids. Okay. And they also have to do fever and pain control. Like if they do, like Tylenol or ibuprofen, these are good interventions for fever control and pain control too. If a child is having chest pain and cannot breathe, of course you have to relieve that pain, and then they would start breathing, and then they would get better ability to fight that germ, and then better ability to rest. And that ultimately is tied to better recovery. And typical flu lasts about 5 days or so. And then there are flu complications, a persistent cough, and it turns sometimes productive. They would cough up phlegm, and then the persistence of the fever. And then those things would make a parent to seek a medical attention and then call the doctor. But if it is anything less of that, then they would try to manage that at home by providing symptomatic care. Symptomatic care involves maintaining an open airway in the nasal airway, and then, as I said, using Motrin, Tylenol, and then fluids, lots of fluids, and rest.
Okay, rest is good. All right. Well, wonderful. So basically, those things do go by. They do pass by. Take care of it. With, as you said, drink lots of water, do rest. Take some medicines which take the pain away, which basically gets you over the time when it kind of like starts going away anyway. You did mention vitamin C. Personally, I'm a very heavy believer in vitamin C. Personally, I eat about 10,000 to 15,000 a day for the last, 30 years. And I don't know, that's just what I do, but seems to be working. And if I somehow come down with a cold a little bit, which frankly happens very, very rarely, my increase by double or so, and on an average it works, with no doubt. So, but anyway, so you say vitamin C enhanced juices and or even maybe vitamin C vitamins or stuff like that, because you mentioned that moms who are pregnant should take vitamins and stuff like that also. So we're going to talk about vitamins a little bit more in other videos of how much and what you think is good for what and what's a daily prevention dose type of stuff. And one thing we should get out of this video is you say going to get and follow the doctor's recommendations of vaccinations. It's good to do.
Exactly.
All right. Thanks a lot, Dr. Tural.